Welcome to myacademy.com. I'm Professor Mahfooz from Pakistan. This is a platform for ophthalmic teaching. In this video, we'll discuss the TOACS session 7, which is about the type of the cataract extraction and the steps in the extracapsular cataract extraction. So let's start. Now, very important slide, the surgical anatomy. You have to remember this is the capsule. This part of the capsule is called anterior capsule and this part of the capsule is called posterior capsule, though it's one continuous capsule, and inside the capsule is the nucleus. So remember it always, anterior capsule and posterior capsule. Let's go to the next slide. We take off the anterior capsule, then we remove the cataract and put the implant in. The implant rests on the posterior capsule. If you don't have the posterior capsule, the lens is going to drop down. So the posterior capsule is very crucial for the implant. Now, there are two types of cataract extractions, extracapsular extraction and intracapsular extraction. In the extracapsular type of extraction, there are four types: lens aspiration, phacoemulsification or phaco, smacky or tunnel type of cataract extraction, and echi or extracapsular cataract extraction. In the intracapsular type of extractions, there is intracapsular cataract extraction and lensectomy. Now remember, we have used it twice: extracapsular extraction and extracapsular cataract extraction. Extracapsular cataract extraction is a type of extracapsular extraction. So when you use the word extracapsular extraction, it could be one of these four. When you use the term intracapsular extraction, it could be one of those. So this is a bit confusing because extracapsular cataract extraction is a type of extracapsular extraction and intracapsular cataract extraction is a type of intracapsular extraction. Let's go to the next slide. Now look at the top one, this cataract. We are going to take the capsule off. Look at that again. And the lens is coming out, but the posterior capsule is still there and the lens will rest, the implant will rest on the posterior capsule. In this example, the whole lens along with the anterior and posterior capsule is coming out. So this is intracapsular cataract extraction. So remember, extracapsular is without capsule leaving the posterior capsule, while the intracapsular is leaving no capsule behind. Remember that. Intracapsular is not in practice anymore. We very rarely do it as a lensectomy. It's only for the subluxated lenses. You either don't put the lens in or you put the lens in front of the iris, which may cause the damage to the cornea. I repeat it, extracapsular means extracapsular or without capsular type of cataract extraction, and this includes lens aspiration, phacoemulsification, sutureless manual extracapsular cataract extraction, and extracapsular cataract extraction. This is a bit confusing. The whole group is called extracapsular extraction, while one part of it is called extracapsular cataract extraction. Now, there are other steps of the cataract extraction, but there are 9 basic steps of cataract extraction. They are incision, viscoelastic injection, capsulotomy, hydrodissection, lens extraction, irrigation aspiration, viscoelastic injection, implant, and wound closure. So let's see them in a bit more detail. Viscoelastic is when you go inside the eye, the aqueous of the eye comes out and the eye deflates. So the viscoelastic you always put to keep the eye formed or to inflame it. Capsulotomy is to make a hole in the capsule like this one so that the lens can come out. Hydrodissection is you hydrodissect it so that the lens separates from the capsule. Lens extraction is removing the lens or the nucleus. Irrigation aspiration is removing the cortex. You put again the viscoelastic to form the eye, and then you put the implant, and you either close the wound or don't close the wound. We'll see them in more detail in the next slide. Thank you very much for being with me, and please do give your feedback. Thank you.